All right, back to politics now. And the Kenya Kwanza government is well into its half-term mark. And so its ambitious Taifa Care program that is now turning 6 months old. The program is one of President William Ruto's key pillars, as promised in the manifesto during the campaign period. Now, the program was set out to resolve the problem of access and provision of equitable, quality and affordable health care for all Kenyans. Our very own Brenda Wanga reports on the hits and misses that have come with the implementation of universal health coverage in Kenya over the last 2.5 years.
It's been 6 months now since the Kenya Kwanza government rolled out its ambitious and intended revolutionary universal health coverage program under the Social Health Authority. Prior to the launch of SHA, the government had set the ball rolling with the passage of legislations that anchored the healthcare program in 2023. The program, since dubbed Taifa Care, operates 3 funds: the tax-funded primary health care and the emergency critical and chronic illnesses funds, and the contributory social health insurance fund, whose cost is borne by the salaried Kenyans at the premium of 2.75% of their monthly gross salaries and a similar yearly amount for the non-salaried Kenyans. This program is aimed at providing affordable, quality and accessible health care to the country's masses.
Kwa sababu hatuwezi kuendelea watu wachache ndio wanaweza kwenda hospitali. Wale wengine afanye harambee, auze ng'ombe, auze mali ndio apate matibabu. Ndio tukasema lazima tuwe na usawa hii Kenya.
But as the program rollout got underway from October last year, its implementation has run into headwinds. Thousands of Kenyans still complain of out-of-pocket payments to access healthcare, beating the purpose of the program. The first hurdle it faced were challenges in getting the public on board due to system challenges. But once that was resolved, the government has been able to ramp up the numbers registered to nearly 20 million, a significant rise from those who were enrolled in the now defunct NHIF.
The bigger picture, and that is affordable, accessible, quality care to all Kenyans, leaving no one behind. And that is what we are pushing for.
But the contributions from those enrolled into Nhif, with a paltry 3 million registered paying the premiums, a fact that continues to hinder service delivery to what stakeholders have said is the only fund that appears to be working to some degree of success. The financial bottlenecks have also seen private healthcare providers withdraw credit extended to patients registered to SHA pending the settlement of previous NHIF debts to the tune of 30 billion shillings.
The Kenyan people are doing their part. They are doing their part to make sure that the social health insurance fund is funded. Our appeal to government is that you also do your part.
What we've seen so far is that things are not working the way they were intended to work. And our members are on the ground in communities providing services, and they can see what's happening. Citizens aren't able to get the services. So definitely, it's clear that something is not working.
The Social Health Insurance Fund implementation also continues to grapple with the balance between the premiums charged and the benefits packages, where the government insists that it has bettered the packages, especially for cadres of critical, chronic and inpatient charges. There is still hue and cry over the packages for treatment outside the country.
Imefika mahali ambaye hatuwezi. Kwa vile hata yeye amesema tumeuza kila kitu.
SHA also continues to fight off allegations of impropriety, especially in the critical digital infrastructure that Taifa Care is hinged upon. A damning report by the Auditor General revealed that the government invested 104.9 billion shillings into the digital system without thoroughly reviewing important clauses in that contract, and consequently, the government couldn't access or control the critical system. However, the government refuted these allegations.
And they are going to make sure that that system will not be paid for by the government of Kenya. It will be a fee-for-service facility that will make sure that we protect citizens' contribution. The people who are complaining are the fellows who have been stealing from us. They don't want a technology system that works because they want to continue stealing from us.
The challenges notwithstanding, the government has been able to increase the presence of healthcare personnel in the grassroots under the Community Health Promoters Program that has seen an increase in the provision of preventive health services, with millions of Kenyans now receiving screening for lifestyle conditions and increased the coverage of maternal health. Even as the government and the Ministry of Health continues to try to steady the SHA ship, the real elephant in the room remains underfunding. From the onset, Taifa Care was meant to be implemented at the cost of 168 billion shillings. However, the government allocated 6.1 billion shillings for SHA. The ministry is asking for additional funds for the remainder of this financial year and the next one as well. Brenda Wanga, Citizen TV.
All right, Brenda, on that note, we're going to take our first break here on Sunday Live. Let you know